May I know your name?
My name is SANDHIYA.
Your age?
25.
Okay, I'm a medical student. Today I'm going to do a musculoskeletal examination for you. Is it okay?
Okay.
For that, I'm start with the shoulder examination. I want you to remove your shirt.
Okay.
For musculoskeletal examination, I'll be starting with the shoulder examination. For shoulder examination, I'm going to inspect your anterior and posterior shoulder.
Okay.
Okay, I don't find any swellings or any deformities, and I don't find any muscle atrophy. Now, I'm going to do the palpation for the sternocleidomastoid and mastoid clavicle. Here it is my acromion from here. This is the sternocleidomastoid joint. Coracoid process. Biceps tendon. It's a groove. Now, I need you to flex your hand posterior. With this position, we can easily palpate the subacromial and the deltoid, subdeltoid bursae and the sits muscles which inserts in this position. Sits muscles is inferior. This position we can easily palpate the sits muscles. Now I am going to do the range of motion. We are having a 6 range of motion. For that I want you to get up. I am going to do a range of motion. For that having a 6 position to know the shoulder movements. We are starting with the first one, which is the flexion. For that I want you to raise your head, raise your hand and straight and above. Do. Okay. Yes. Second one is extension. For that, I want you to take your hand back. Okay. Thank you. Next, we are going to do an abduction. For that, I want you to raise your hand at the level of your shoulder and upwards. Okay. Thank you. Secondly, we are going to do an adduction. For that, I want you to raise your hand at the level of your shoulder and straight away. Okay, thank you. Secondly, next we are going to do an internal rotation. For that, take your hand to the back and touch the opposite side shoulder. Okay, thank you. Third, lastly, we are going to do an external rotation. For that, take your hand to the level of your shoulder and do like this, just like we are doing a present set. Okay, thank you. With these range of motion, you will be knowing the shoulder movements and the muscles which are involved in this. Thank you. And now I am going to do a crossover test to know the acromioclavicular joint. For that, I want you to raise your hand like we did for the adduction. Yes. I don't feel any tenderness or any swellings, so you are negative to the crossover on. Now we are going to do the half place cast test to know the whole shoulder rotation, movements of the whole shoulder rotation. For that, take your one hand to the upper side and the next hand to the lower. Try to touch both the hands. Okay. Thank you. Another to the sketchy test. Thirdly, we are going to do a near impingement, Hawkins impingement to know the rotatory cuff movements. For that, firstly I am going to do the near impingement. For that, I want you to turn around. I will be placing my hand in the shoulder. I will be pressing your scapula. and try to move. Okay. It's an air engagement. Thank you. Now I am going to do a Hawkins impingement test. For that, raise your scapula like this. Okay, thank you. I noticed your rotatory cuff movements. One empty cam test. For that, raise your hand, both the hands at the level of your shoulder. I will be pressing the wrist. Resist me. Okay, thank you. Now, this is for the supraspinal test. Now we are going to do infraspinal test. For the infraspinal test, for that, flex your elbow at the level of your arm. Resist me. Okay, thank you. Now I am going to do a drop-off test to know the movement of the entire muscle. For that, raise your hand above the level of your shoulder. Slowly move down. Thank you. We'll be in with the shoulder examination. Now I'm going to do a hand and grip examination. I'm going to do the hand and wrist examination. For that, I'll be starting with the inspection of your hand. Can you show me your hand? I don't find any deformities. Now I'm going to palpate your hand palpate to find the bones. Ulna, radialis and the groove. I'll be palpating a carpals in your wrist. And this is 5 metacarpals. The proximal interphalangeal, digital interphalangeal, and this is a distal interphalangeal. I don't find any swellings or any deformities. Now I'm going to do a range of motion. For that, I want you to hands. For that, I want you to flexion, extension, adduction. Okay, I don't feel any asymmetry. Now I'm going to do a test for the hand grip strength. I'll be giving my 2 hands. Just grab this. Right. Okay. I'm going to do a Pennington test. For that, I want you to place the hand like this. Okay. Just do like this. Do you have any pain?
No.
Okay, thank you. Now I am going to do a carpal tunnel test. There is 3 carpal tunnel tests: thumb adduction, tangles, and phalanx test. Firstly, we are going to do a thumb adduction test. For that, place your hand like this. I will be placing my hands in your thumb. Just resist me. Okay. I don't find any weakness, so you are not ready to do this test. Second, I am going to do a tangles test. For that, I will be tapping a median nerve. If you have any pain, kindly let me know. Do you have any pain?
No.
Okay, thank you. And I will do this tangles test. Now we are going to do the phalanx test. For that, place your hand like this. A stay, which should have a 90 degree. Just give some force to the opposite. Do you have any pain?
No.
Okay, thank you. You are negative to the phalanx test. We are in with this hand examination. I want to do the range of motion for the hands and the fingers. For that, you will be doing a flexion, extension, abduction, and adduction of your fingers. Place your hand like this. Like this. Flexion, extension, adduction. Okay, thank you. I am going to do a range of motion for the thumb. Place your hand like this. Just repeat me. Flexion, extension, adduction, adduction. Okay, thank you. Now I am this end with the hand and grip was the examination. Now I am going to do a knee examination. For that I want you to lie down. Do a knee examination. For that I want you to flex your hand, leg. Now I am inspecting the knees. I don't find any different alignment or any deformities. Now I am going to palpate for the bony ridges for tenderness. I don't find any tenderness. Now I am going to check for the swelling in suprapatellar. I don't find any swellings. Now I am going to check for the ligaments. Now I am going to do a range of motion for the knee. For the range of motion of the knee, for that raise your leg to this position. Okay, down. Yes, move your like this. Abduction, adduction, internal rotation, external rotation. I am going to palpate for the minor effusion to know the fluid waste. For that I am going to do a bulge sign test. For that I am going to press downwards and laterally. I don't find any fluid movement, so this is negative to the bulge sign test. Now balloon sign test to find the major effusion. For that I will be placing my thumb and the index fingers in the index finger in the patella, and I am compressing a suprapatellar pouch to feel any fluid change. So this patient is negative to the balloon sign test. Now I am going to do a volatile sign test. For that I am going to compress from up and down of the patella and feel for any tenderness. So it is negative to the volatile of a patella. Now I am going to do the knee maneuvers. For that, firstly I am going to do a middle collateral ligament examination. For that I am going to do a varus thrust test. For that I will be placing my one hand behind and one in an ankle position. I will be stressing a knee to the lateral and ankle to the medial to know the medial collateral ligament movement. Nextly, now I am going to do a valgus stress test to know the lateral collateral ligament. For that I am going to medially I am going to stress the knee, and laterally I am going to stress the ankle outwards. It's not very clear. For that I am going to flex the hand, flex the leg from the examination table. Flex the leg from the examination table. From this position I am going to press the knee medially and the ankle laterally. At this position, we can easily palpate the collateral ligament. Now, I am going to do a anterior jaw test. For that, I am going to flex the leg to 90 degree. With this, I am just going to draw to know the tibia movements. Nextly, I am going to do a posterior jaw test. That I am going to place the leg to the 30 degree to know the movements. Just we did for the anterior jaw test, I am going to give the pressure from the anterior side to know the posterior position. Okay. Now I am going to do the lateral McCourney test for the medial and lateral meniscus. For that, I'm going to fully flex the leg and rotate it. We should repeat this. This is for the lateral meniscus. For medial meniscus, I'm going to flex fully. Let's end with the procedure. Thank you.